to start. My name is Dr. Frank Urasek, and I've been a practitioner of Chinese medicine for 39 years, and also have taught in a number of schools, and currently am the director of acupuncture at Cook County Hospital, Stroger Hospital, with programs in their ER, surgery, and pain clinic under the anesthesia department. What has really caught my attention in our medicine lately is this idea of how it looks through science, the science window, and through Western medicine, given that it's been around a lot longer than that. And any way that I can demystify and help explain what's happening, I'd like to do that. And that's why I'm turning to our guest tonight, who I'd like to introduce himself and his background, and then we can start building that bridge between Chinese medicine and Western medicine.
My name is Rishan Al Elakom. I hold a degree from Loma Linda University in Preventative Care and Behavioral Medicine, and another degree from Argosy University in Clinical and Forensic Neuropsychology. I have been practicing in the United States for about 40 years. I'm now semi-retired. I'm also board certified in biofeedback and physiology, and in medical nutrition. Currently, as I said, I'm retired, semi-retired. I practice in South America, in Suriname, north of Brazil, and I do some other volunteer work. So that's somewhat my background.
Great. So I'd like to get, so I can relate to it more, a first impression of your experience and knowledge about Chinese medicine, specifically acupuncture and manual therapy, which are the two common utilizations here in the United States.
I don't have special training in Chinese medicine, but I think with psychophysiology and biofeedback and my background in clinical neuropsychology, I can relate to the mind-body relationship. As I understand it, Chinese medicine tries to manipulate or relate what goes on in the brain with what goes on in the body. And we know that the whole body, all the organs in the body, have what we call plasticity. What plasticity means is the ability to adjust. All the organs, depending on how we use the organs, make an adjustment to whatever input we give. For instance, the heart, if we exercise regularly, the heart muscle gets stronger and our resting heartbeat goes down. That is a response to the aerobic exercise that we perform. As far as the brain is concerned, learning is basically a plastic process. And let me explain what plastic means. If you take a piece of plastic and wrap it around an object, it sort of accepts or takes the shape of the object. When we expose the brain to input, learning or other activities, visual, auditory, tactile, olfactory, and gustatory, the brain takes that information and the brain does something with it. And part of what the brain does, besides storing the information in memory, is the brain makes an adaptation so that when we encounter the situation again, the brain has already some information stored so that it can relate to the information. For example, when someone goes to school, let's take a child who starts first grade doesn't know how to do math, science, or reading. And each day when the teacher relates to the students and gives them homework, explains things, the brain takes that information in, and the brain stores the information. But not only does the brain store the information biochemically, the brain also makes an adjustment in its network. The synaptic junctions, that's where the cells communicate with each other, change. In fact, research has shown that the synaptic connection becomes stronger physically. So there's a physical change that occurs in the brain, so that when we encounter the information again, the brain can quickly, it's almost like a RAM memory in computers, quickly pick up the information and do something with it. Going back to a student who doesn't know how to add or subtract, multiply, etc., after a number of lessons and test sessions, eventually, when you ask the child, how much is 4 times 3? The child can give the answer. Previously, the child, I don't know what you mean. But because of the learning process and the adaptation that the brain has made, the child can give that answer in a split second. So the brain has adjusted itself. We call that the plasticity process, so that the brain can actually use the information in a very short time. If someone starts a new job, initially, within the first 6 months, typically the person may have to refer to a manual or maybe ask a coworker, do you remember how to do this? Can you show me? Typically within a 6-month period, the person may have learned all the tricks and of the job, the cues, and doesn't have to refer to a manual anymore, because the brain has adapted itself to the task, and the processes have become automated. So the person, if it's a particular task that the person has to do, as soon as the person, I need to do that, okay, I know how to do that. A person who learns how to type, if you learn how to drive a car, initially the car feels like it's a big, heavy object to the brain. After you've practiced, you step into the car. None of us, when we get into a car, think about driving anymore. We just drive. And how is that? Because the brain has made an adjustment to the task of driving. Everything has been automated. It is all through the process of plasticity that the brain is able to do that.
Great overview. Now, what does this have to do with Chinese medicine or with the stimulus response that acupuncture and manual therapy, there are 2 forms of manual therapy that I employ. One is Chinese in the acupressure piece, and a number of techniques to stimulate the body. And then there is a soft form of physical therapy called Sotai, which is Japanese, which takes the body in the direction of ease as opposed to dis-ease and retrains it. So what I want to do is take what was just said that involves external stimulus and external objects and say, how about if we could stimulate internally and we could change internally using the frontier of our skin as opposed to what's outside of it. And that's what I'm saying is the possibility here, that we actually have the ability, using these mechanics and this process of a medicine that was pioneered through trial and error 3,000 years ago, cumulatively. And initially it was pressure, and then it was a provocation using sharper objects, and then in the time of metals, needles, And now, thanks to technology, it can use laser, it can use electrical stimulation, it can use sound, like tuning forks, to stimulate those points in a way that the body can turn in on itself, can involute, and actually apply these dynamics internally to strengthen that connection between body, mind, and brain. And I'd like to refer to the book that was a starting place for me after I found the basic definition according to a basic understanding that what wires together fires together. If you can rewire, if you can fire, you can rewire the brain. And I think the most interesting short-term illustration of that was the guy that walked into the ER in New York with a pipe in his head that had wiped out the area of his brain that controlled speech and the use of his hands, and he was speaking and using his hands clearly. He was operating outside of that area of the brain, but using and calling on adjoining areas of the brain to take over that function. And that really kind of radically redefined this whole idea that the brain is not compartmentalized. It has the ability to morph into other areas and create resonance that can take over function and restore function instantly. That's the big thing here. Because what I had as a topic today was how, and I've seen it time and again in my 40 years, how can the process of acupuncture and Tui Na actually, in some cases, create this instant healing reflex? How can it possibly do that faster, as fast as the speed of light? There's some kind of communication that went on that allowed that to happen, that allowed the previous condition to fall away and there be a reboot. And so there's a book that's been out for a while on neuroplasticity called The Ghost in My Brain, which talks about this DePaul professor who was in a car accident, had a traumatic brain injury, and it would take him 3 hours to walk 3 blocks from his car to his office and back again at the end of the day, 6 hours a day to walk back and forth to his car, almost a full working day, huh? And he literally, using these neuroplastic principles, was able to recover at least, we can say fairly fully, at least 80% of function. That's unheard of, and be able to take care of, as a single dad, his boys. So he had his life restored. And so it's a phenomenon that can take some time or literally no time at all. You can have this spontaneous healing effect, or it can be over a period of time, depending on the kind of stimulation. And the 3 principles he uses in his book, The Ghost of My Brain, is attention, intention, rehearsal. AIR. Get the attention of the body, brain, mind. Have an intention to fix or take care of or address what's not functioning, and rehearse that. So that's the formula that he used, and he explains for his incredible recovery. Then there's another Dr. Daji, who is from South Africa, who wrote a book, How the Brain Heals Itself. And that breaks down by saying that the mind controls the brain and the brain controls the body. So there's the sequence here that can stimulate a response to recover what was thought to be lost and diagnosed to be lost. And I want to go back and get some feedback on these comments, because that's the beauty of this conversation we're having, is we have two different experiences from two different points of view, and we have this phenomenon that I'm trying to wrestle how it can be recreated so consistently and predictably. Because when my patients walk away and they see this rapid return of function, independent of pain, which is what's addressed, pain that's addressed with drugs, drugging the brain, pain that's addressed with ablation, the nerves are cut, so the message is interrupted. Interruption in terms of an electrical signal with an implant. So what I say is happening here is that there's an attempt to address a mechanical issue, a flat tire, by throwing aspirin in the gas tank. It doesn't work that way. That we really first have to really take a look at what's physically going on, what's mentally going on, what's emotionally going on, and how can we empower these three areas to recover rapidly. And so that has to be a combination of proper diagnosis, what's involved here, accurate diagnosis, not just from one perspective, not just from an MRI, not just from some history, not just from some blood work. These are all valuable and important, but a much deeper understanding of what's happening here and what's the interference that can somehow restore that signal and restore that direction and have more rapid recovery. So I'd like a little feedback on that.
Yes, I think I want to anchor in on one of the points that you made. One of my complaints is that Western medicine has done a good job dealing with emergencies. Surgery, if I had some mechanical problem, I would want to have someone in allopathic medical knowledge and skills to deal with that. But the human body is not only mechanical. There is the issue of intent. I've seen the mind override the effect of certain medications. A patient takes an anxiolytic for anxiety up to the maximum dose possible, and the patient still complains about being anxious. So the mind has a way to override sometimes the molecular information that we provide. So there is more with intent. And if you treat the patients with more of a cognitive behavioral process or strategies, and look at what is it that generates the anxiety, for instance, with the patient, and then you find out that there is a thought process about a situation that the patient ruminates over. Maybe something that they would have to have, they can't have it, they've lost something, a relationship fell apart, and they don't know how to restore the relationship. And you administer anxiolytic, that is a medication to reduce the anxiety, or an antidepressant for that matter. But the origin or the seed of the problem is not the symptom. There is something behind the symptom. And if you address that, then typically the symptoms subside. So here you have, Frank, you were saying that the intent is important. So what is the person thinking? What are they aiming at? what is their goal. If that can be restructured and that is not physical and visible, we can do an MRI scan and see the thoughts. We can do any other scan, fMRI, and with fMRI we can see that oxygen is being used by a particular part of the brain, but we don't know what the oxygen is being used for. So we can't read the thoughts. We can do a quantum EEG, and we can look at how the various areas in the brain communicate with each other, but we cannot tell what the areas are communicating about. So intent is very important, and you have to try to help the patient through a process where their thinking, their intent, the feelings, because thoughts generate feelings, and feelings and thought have an impact on our behavior. If the person can learn to pinpoint what am I thinking about right now, and how does that thought impact my emotions, what sort of emotions are evoked. It could be positive. If the thoughts are positive, the emotions are positive, the feelings are positive. If the thought is negative, the feelings are negative. And the behavior is then impacted by those two components. So the mechanical process, which I call the engineering model, doesn't work always. It's more than that. You have to understand, like you were saying, what is it that's behind the symptoms? What is the person experiencing? What is their intent? Does the person really want to get better? That's an important component, because some people leave the responsibility to get better to the provider. They walk in, doc, do your thing, and they walk out. And they expect that just because the doctor has given certain instructions or provided some medication, then it's going to happen. And they don't take responsibility to help that healing process take place. So intent is very important.
Yes. So I'm going to jump into a very specific stimulus response situation that occurred, and the power of microsystems, parts of the body, based on the idea of the hologram, that the part contains the whole. So there was a French doctor, Noget, who discovered that you could treat the whole body from the ear. And he discovered that after he had a patient come in with a little burn mark on her ear, and she had complained that she had had back pain, and this folk healer had cauterized that area, and the back pain had disappeared immediately. Now, a lot of acupuncture and dry needling and trigger point therapy concentrates on the area of the pain, which I say from our perspective is a improper and insufficient expression of what's there and what's available for us to access that keyboard that commands certain parts of the body to act in a certain way. And the auricular points I've had a lot of experience in dealing with, and I basically worked for 14 years at the state's, one of the state's largest drug and alcohol treatment centers, using the 5-point NADA protocol for addiction and alcoholism and violent behavior. And I think it's as important to work on the ears as it is to work between the ears. So there has to be a message on the backside of that keyboard, that can reinforce what you're doing on the keyboard. A. B. The beauty of the microsystems is you're away from the initial area of pain. So you're not reinforcing the pain signal and setting up a whole automatic response that puts you back into immobility. I've seen that time and time again. And the way to stimulate these points has become much different since we first started with this medicine with pressure, and then went to puncture, and then we went to laser, and then we went to electrical stimulation. There's actually another form that I discovered, which is the energetics of homeopathy. So there's a very common way to deal with points on the ear using these tiny vicarious seeds and having the patient squeeze them to stimulate that point, that homunculus that relates to either the shoulder or the back or any other part of the body that Noget discovered. I was treating this patient who had an addiction and alcohol issue, multi-drug issue, for shoulder pain. But I did not have those little vicarious seeds that we used put on the ear and asked the patient to squeeze. I did have magnesium phosphorus, which is a homeopathic cell salt of MagPhos that was discovered by German Dr. Schussler. And I said, okay, I don't have the seeds. I'm going to tape this homeopathic pellet onto that ear point and see what happens. So I took tweezers, put a pellet on tape, took the tape, put it on the shoulder point of the patient's ear, and I said, okay, I want you to move your arm. And she immediately moved it with no pain and full mobility. So I'd set up a situation for her, a cause-effect situation that she could either buy into or not, that would override that pain memory, allowed for that, so that she could start from clear ground. That was probably 30 years ago. Last year, I had a young inmate, we call them, we have a different term that's less prohibitive, a detainee. He was an angry young black man who had an acute sickle cell episode. 2 weeks before, I had met a doctor from cardiology who I noticed her, she was limping and her one heel was crooked on her high-heeled shoes, and I walked up to her. I'm kind of a chatty guy in the hospital. I said, do you have back pain? She said, yes. I said, it's probably because your heel on your one shoe is crooked. So she's had a displaced pelvis, and that was causing a signal effect that was having her compensate. So, I came across as a wise guy, of course, which I am from time to time. Some people know that. And so she said, so what do you do? I said, well, I'm an acupuncturist. And she said, well, and I said, I treat pain. She said, well, do you treat sickle cell? I said, no, I haven't treated sickle cell. And she said, well, it's a significant problem. You ought to check it out and take a look at it. Well, 2 weeks later, this detainee shows up, who my boss, Dr. Torres, says this guy has attacked healthcare workers, is a drug hoarder, and is a runner. And so that's a challenge, I thought, but what the heck? So I walked into the room where he was shackled to the bed with a sheriff deputy presiding and one outside the door, just in case he wasn't big enough or armed well enough to slow this guy down. And again, this is all I have to be careful what I say, but I think an overstatement of restraint. So here we have this overstatement of restraint with this young black guy in pain. And I say to him what I say to a lot of patients, what my first teacher back 40 years ago, who had trained barefoot doctors in China, in Shenyang, would say in his broken English, how can I help you? And he screams at me, I've got sickle cell, acute sickle cell. I looked at him and I scrunched up my face, and because he has a history of being provoked, I figured I would ubi venatum et curatum. I would fix I would heal with the poison that created the condition. So I said, I'm sorry, I don't treat labels, which was, of course, the last thing he wanted to hear. But I didn't want a stereotype response to this guy's complaint. I wanted it to be real. And that's what I think. We don't have that incredibly complicated response where we're looking at blood work, we're looking at x-rays, we're looking at past history, we're looking at psych, we're looking at all of this. I wanted to know what was hurting him where. So I said, I don't treat labels. I said, where does it hurt? And he screams at me, my elbow. So he's frustrated. And he thinks that what I'm going to do probably isn't going to work. That's what I'm addressing here. That hopelessness, one more guy that thinks he's got an answer here, that doesn't know me, doesn't know my pain, doesn't know what I've been through, and he thinks he's actually going to help me with his bag of tricks. At which point, I reach into my pocket and I pick out a little sheet of vicarious seeds, the size of mustard seeds. He looks at that. He says, what are you going to do with that? In disbelief, like, you're going to actually do something with that tiny thing? I said, well, I'd like to put it on your ear. He said, and this really drove him crazy. My ear, you see, we're totally out of the conventional paradigm, and I'm trying to use that to advantage. Like, this is not the same old song that's been frustrating to you and made things look hopeless. That's the beauty of it. We're in a different paradigm. So I said, I'm going to put it on your elbow point, on your ear. And he looked in total disgust and disbelief. And I put that seed on the elbow point, the lower part of the ear. It's an upside down homunculus baby. And I went to the other side of the ear and put it on the other side, and I squeezed, and he grimaced, huh? You know, like, what's this dude doing now, trying to hurt me? You know, this is, you know, memories of getting yanked by the ear in school, you know? It could have some very unpleasant memories that he reacquaints himself with. But I squeezed it about 5 times, and I said, okay, move your arm, which was immobilized from pain. He immediately moves it, no pain. So that's what I'm talking about. The possibility is here, what could be described as spontaneous healing, but not really. That sounds too mystical, too magical, that somehow we were able to fuse, as Daji says in How the Brain Heals Itself, the mind commands the brain, and the brain commands the body. Somehow we connected that process of mind, which is much more undefinable than brain, right, and brain and body having some kind of a process that stimulation, that sensation in the area that was mapped out in 1954 by a French doctor after he saw this scar on the back point of this patient that presented to him. And then he started using actually high-intensity light to stimulate those points and define the whole body in terms of organs and structure. And his student, a German doctor, actually took a look at, Frank Barr took a look at stimulating the creation of drug analogs in the body, which is really far out. So there I am with this Schussler cell salt, taping it on this patient's ear 30 years ago, and then coming up and taking a vicarious seed and taping it on this guy's ear, again to stimulate a response, and he's able to move his arm without pain. So something happened there, something that is recreatable and predictable, and more predictable, that combines the system that was mapped out in trial and error with traditional Chinese medicine, and then it's being adapted in Japan and being adapted in Korea and being adapted in other Asian countries, and then imported over here after Secretary Stanton, Secretary of State, was with Nixon and had a rush appendectomy, and acupuncture helped his post-surgical pain back then. And now here we are at Stroger Hospital using stimulation of the ear to complement anesthesia so they can have a better and easier job of connecting pacemakers, that wiring to the brain function, or helping with ablation of the heart to sync up a more functional beating of the heart. So we've had this explosion of different technologies with a predictable, less invasive, less heroic effect that has extraordinary, simple results. That's a lot of information.
Yeah. I would like to address the issue of intent and show how intent and anticipation can actually generate a physical response. Okay? For 5 years, I worked in a pain clinic, chronic pain clinic. We had patients who had head injuries, physical injuries from work, falling, being hit by objects, etc. And they would come to the pain clinic. We had a neurosurgeon there, we had physical therapy. I was in charge of the cognitive behavioral component with biofeedback. And biofeedback, let me explain that just briefly, is where we use instruments. And we put the instruments, the probes on the body, and then we ask the patient to change the signal by thinking.
Ooh.
For instance, you can raise your body temperature just willing the temperature to go to rise. You can increase your muscle activity, and muscle activity is all electrical and microvolts, or lower the activity in the muscle by thinking about lowering it. And we can demonstrate that because the instrument is connected to the patient and you can actually see the temperature go up. There's training, of course, how to think the temperature to go up, and the temperature can come down. To think the muscle activity to go up, and it come down. To, of course, breathing, but you can also regulate your breathing. But anyhow, I remember this gentleman, I think he had a back injury, and chronic pain has an enormous consequence, social consequence. He could not work and earn as much as he did before. After his the payment that he would get from his company for the injury. And one of the issues was when they go on vacation. One of the things he had to say to his wife, well, we can't go too far because I can't tolerate sitting this long in the car. And of course, the kids are complaining, Mom, Dad, we want to go there. And the first thing that he had to say, well, I can't sit that long. So the kids were frustrated. The mother was frustrated. They were about to lose their home because the mortgage could not be paid for on time, etc. But anyhow, I had him as one of my patients. And ask him, tell me, how does this pain operate in your life? So he began to tell me, in the morning when I wake up, the pain is minimal. But around 10 o'clock, it seems like the pain miraculously gets stronger. I said, okay. So what are you thinking between waking up in the morning and 10 o'clock? Well, what surprised me is that he said, I eat breakfast and I'm in minimal pain. But I'm beginning to think, when is the pain going to strike? When is the pain going to hit? And his anticipation was around 9 and 10 o'clock, the pain is going to be full blown. So his anticipation about the pain arriving actually influenced his perception of the pain. So around 9, 10 o'clock, the pain got worse, and it's like a self-fulfilling prophecy. See, I know the pain was going to be bad around 9 o'clock. And sure enough, so this cycle of intent or anticipation and belief and actually experiencing the pain had become automated. So his life was revolved around chronic pain. And he also told me, he said, you know what, Doc, I'm trying to fight this pain. I said, okay, well, tell me, how do you do that? He sort of, is a big word, anthropomorphized the pain. That means he gave the pain the quality of another human being.
Oh, my.
All right? So he would perceive the pain external coming to fight with him. And he said, you know what? I wish I could get into the ring with the pain and fight the pain. I said, well, can you see the pain? No, but I know the pain is going to strike around 9 o'clock. So if I can get ready, maybe I could take him out. So I said, okay. Now, what happens when you get yourself ready to fight? Okay? Your whole body tenses up. Okay? Blood pressure goes up, heart rate goes up, muscles tighten. I said, if you do that, then you actually are creating a condition where that chronic pain is going to be worse. So actually, if you try to fight the pain, you're going to lose. Because the very position that you take, the intent to fight the pain, is actually playing into, quote unquote, the pain process. So, I worked with him on relaxing, taught him some relaxation training, also some biofeedback, where we hooked him up to the instruments, and then he could learn how to decrease muscle tension, breathing techniques, and he was able to manage the pain much better. And even with the pain medication that he was getting, because of his intent, his perception that the pain is something outside of me that comes and fights me and makes my life miserable, and I want to get rid of it. So the idea is, if I can fight the pain, if I can defeat the pain, then the pain is going to be gone, which was not the case. So his intent, anticipating the pain, actually increased his level of perception of the pain. So here is a relationship between thought. We can't see our thoughts, but we can perceive them. But what he was thinking had an effect on his physical body and his perception of the pain.
Interesting. EFT, Emotional Freedom Technique, which is Callahan developed after he worked with this woman who was afraid of water, and he tapped certain acupuncture points on her body. And that's what I found was interesting. There were acupuncture points that he knew where they were located, and he tapped them, and he had her say that she was not afraid of water. And after she was done with that, it was a very hot day, the air conditioner wasn't on, she opened his window sliding door and jumped into the pool in his backyard and started swimming around. So there is this whole emotional freedom technique, tapping of the acupuncture points and reinforcing where what you want to do, where you want to be emotionally and physically, that there's a whole system of it. And another one as well with eye movement. And I think it was the eye movement training.
EMDR.
Yes, that was used by this fella who had this problem of walking 3 hours to get from his office to his car. So there are things that, or activities, or I won't say rituals, but sequences that seem somehow to be able to restructure this relationship between mind, brain, and body on a fairly routine basis.
And maybe I can say something here about networks in the brain. The brain operates on electrical signals. And that's why we can do an EEG. We can see the analog signals. And quantum EEG is where we take that analog signal and process it through a computer. Then we can look at more specific issues. As I said before, we cannot hear what is going on, but we can actually see through the physical processes which areas in the brain, we call them the Brodmann areas. There are 52 of them, discovered by a German doctor in the 1940s, and what we call by cytoarchitecture. That means he looked at the brain, slices of the brain. I think he was an anatomist. And under a microscope, he could see that the structures of the cells were different in different areas. So he assumed if the cells look differently, then probably they function differently. And with the primitive instruments that he had at that time, today we're able to show that he was right. Okay, so the Brodmann areas, you can see how the Brodmann areas, once you put the analog EEG through computer programs, and you can actually see how they talk to each other. Okay, this issue of networks. Sometimes when people hear, your brain is not wired correctly, there's a string loose. Okay, let me clarify. There are no wires in the brain. The reason why people tend to think that brain cells look differently than other cells in the body. The brain cells have an area where the nucleus is, you call that the soma, and then there is an extension coming from the brain cell, we call that the axon. And the information goes from the area of the soma, the nucleus of the cell, that way along the axon, and this axon connects to another cell. But it doesn't touch the cell. There's a gap. We call that the synaptic gap. And that gap allows for messages to be transferred from one cell to the next via neurotransmitters. These are chemicals. People know about dopamine, norepinephrine, etc. So these are the chemicals that take the stimulus, the message from one cell in the synaptic gap and pass it on to the next cell. So when you look at the structure, maybe anatomically, it looks like a string. But it is not a string, one long string. These are just cells, talking to each other in line or etc. So networking, these cells network. We have some basic sensory networks. The visual network. I'm sitting here, I'm looking at you gentlemen, you see me. The information comes through wavelengths, and the eye picks that up. And the eye doesn't see anything, it's the brain that does. Okay, the eyes pick up the wavelengths of the light, and it's processed, and in the occipital area, the brain says, okay, I know this gentleman, I know this, I know this is a microphone, etc. And we have the auditory network. Information comes in, and it's processed in an area in the temporal lobe. Then we have the olfactory network. You go somewhere or you smell, say, it smells good. Or it doesn't smell that good. All right? You touch something. This is tactile. and then you taste something, the gustatory network. These are external networks, but they are based on the stimulus that comes from the sensory organs. But there are networks inside the brain that respond to these stimuli, but perform very delicate and complex processes. For instance, at night when we go to sleep, the default network monitors everything in the body. And also, when we sit and, we're relaxed and we reflect on the activities that have gone on or what I'm thinking, that's a default mode network. The salient network has to do with looking at what's important in the environment. Now, if the door opens right now and we see a tiger pokes its head through the door, okay, our salient network is going to say, wait a minute, it's not supposed to be here. Tigers are dangerous. We can be hurt. Okay, our heart rate goes up, blood pressure goes up. The fight or flight, in this case, we will think, can I fight the tiger? No. The best thing to do is to flee. Okay, so the body gets itself ready because of the salient network. Blood pressure goes up, muscle tension goes up, blood drains away from the stomach, more blood to the brain and more blood to the muscles because we need to run or fight. So these are complex networks. There are other networks that are also involved. But here is the relationship then between what we experience in the environment and the networks in the brain. And these networks communicate with each other. Okay, the olfactory network communicates with frontal lobe, communicates with maybe the language network, because I've heard something and I need to respond. So auditory sends a message, language network, and then I think about what the response is going to be, and then I make the response. Okay, and then areas in the Wernicke's and Broca's area make it possible for me to say what I want to say. But the frontal network, executive network, has screened what I'm going to say. No,
Sometimes.
I can if everything works well, I can say this right now and it's appropriate. Or I better not say it right now or not say it the way I thought I wanted to say it because it may not come across well. It may cause a problem. So then we think it, but we don't say it. So, and there are many more networks that I'm going to mention, but to show the complexity of these processes and how the brain, for instance, the brain is in direct contact with the gastrointestinal tract. Not hormonally, but direct, through the vagus nerve, the 10th cranial nerve. You find some people go somewhere and they smell something that smells terrible. Next thing you know, they say, I feel like I have to throw up. And some indeed, they throw up, just because they smelled something. So the olfactory stimulus went to the brain, and the brain is communicating then to the gastrointestinal tract, and the stomach comes into action. Vomit. Yeah? The person vomits. So there is, that there is a direct connection. When people are depressed, sometimes they don't feel like eating. Their appetite is low. Something happens, they're frustrated, they've lost their job, or relationship is going bad, depressed, and their appetite is gone. Everything works fine. I mean, if you do an upper GI, whatever it is, there's nothing wrong. If you do blood work, there's nothing wrong. But they don't have an appetite. That's the direct relationship of the brain to the gastrointestinal tract. So we are a system.
Yes, overlapping systems.
Unfortunately, in Western medicine, we've divided out. I look at the nose, you look at the fingers, somebody looks at the bones.
Not so, though, in Eastern medicine. We really deal with the holism. It's really interesting because this connection with the brain, and in terms of evoking a healing response, is so profound in my experience with scalp points that the Dr. Zhu, who was one of my teachers, demonstrated. And if you, it's he mapped out the scalp as areas of the scalp that were directly over that area of the brain that controlled an area of the body. So, and it was a homunculus. It was a face-up homunculus with the face here, and then this area being the from the head, from the chin down to the pelvis, and then the legs out here at 45-degree angles, I'm sorry, this way, and then the back of the head was the back of the skull up here, and then the spine down this way. And so with that diagram, so we study it, we say, okay, if you stimulate a certain part of this homunculus, you can influence a part of the body that's not even near here. And so unfortunately, a lot of the acupuncture that's practiced, whether it's acupuncture or whether it's dry needling or whether it's trigger point, is going to the area of pain, which reinforces that pain signal. Who wants to get hurt where they already hurt? Huh? And I've seen time and time again being able to use ear points way away from any part of the body that hurts, or the scalp, but particularly the scalp dramatically. If you do those points that Zhu mapped out. And the third area as a microsystem is the belly, which is the sacred turtle, which is this turtle with 4 flippers at the appropriate areas at the end of the shell, that you can treat the limbs of the body and then treat the head and the spine. It's just phenomenal that by going away from the area and stimulating these areas, you get an immediate feedback possible than going to the area where there is the pain. And in many cases, predictably, a remobilization of a part of the body that was not mobile, and there was this whole history of pain in the way in preventing it. Somehow you've bypassed that history. In fact, when you go to the amygdala point in the forebrain, where that's the pain memory point, and you interfere with that pain memory, take that away, neutralize that, and then stimulate the areas that you want to remobilize, it works. Same with up here. You go over to that area of the body that has pain and immobility, and the two are locked together. Immobilization worsens pain because we are designed as mobile creatures, and that function is in the closet. And so you don't have blood circulating, you don't have nerve activity, you don't have all these other systems intertwined to help with healing. And if you can bypass the local concept and go to master areas of the body that Noget did with the ear. I had a veteran in Bethesda Naval Hospital, one of 17 we were treating for phantom pain after multiple limbs had been blown off in Iraq. This guy was in crisis. He was hyperventilating. He was sweating spontaneously. He had his legs amputated. They had debraded the stumps to try to clean up the healing area, but morphine was not touching his pain, and he was in crisis. In Chinese medicine, kidney rules the bones. Kidney rules energy. I'm talking about the meridian and the organ through which that meridian germinates. And the ear is the external kidney. The eye is the external liver. The tongue is the external heart. The lips is the external spleen. So we have these parts of the body that relate to an organ. And then we have emotions related to the organs in the ear. So we have these multiple keypads that we can access outside the realm of normal thinking, outside the realm of blood tests and x-rays and all of that, that have been figured out and documented with a very specific response. So here's this guy. He's got pain. It's unimaginable, and it's in an area that's missing on his body. And I take a single dart, an Auger dart, with an injector. The dart is about the size of a pencil lead. And there's a magnet on the end of the injector which magnetizes that point. And I look, there's no legs, and I want to go stimulate the kidney meridian, which is on the legs primarily. And I say, where am I going to go? And I think, aha, the speed of light. The ear is the external kidney, and the kidney point is here. So I'm going to go to the external kidney and go to the kidney point to stimulate bone energy. I put that dart in, immediately he comes out of crisis. And I didn't explain to him what I was doing. It just worked. Now, whether it was my intent or our fused intent, or we can get into that whole discussion, but the point is that I see it as principle and precision that has been worked out a long time ago in a different paradigm, that when executed, more times than not, there is a change in that body, mind, and mental or brain dynamic.
Yeah, as you were mentioning, stimulating certain points, and I sort of emphasize the thought process. So you see an intertwining there of the invisible, this is the thought,
Yes.
and the physical visible,
Yes.
and that's why we're saying that the human body is a composite. It's a system. You have to think of the human body in a systems approach.
Yes.
It is not just the head, the hair, the feet. It's a system, because each one of these components, parts, has an effect on the other.
Yes.
If you're in pain, your thinking is not straight. Yes. Your attention is also compromised. Your memory is compromised. Even your speech is compromised. We can't see any link between speaking and the pain, but the pain impacts the perception of the pain. And pain has also a reverse impact on critical thinking and attention. So it's a two-way street. The nervous system, the brain is the central part of the central nervous system, has a monitoring effect on all the organs. For instance, we know that they're in the parietal lobe. We say, but it's not a physical map, but there's an area in the parietal lobe, and let's call it a map, where the whole body is mapped to the millimeter. So when you go to the neurologist and he has the little needles, sometimes 1, 2, 3, he wants to see if you can discriminate the signals. And that's because in the parietal lobe, everything, the sensory points are all mapped out. Now, for instance, we can demonstrate that. For instance, ask somebody to close their eyes, and you say to the person, the patient, I'm going to touch you somewhere in your body. Eyes closed. All right? And then you have to tell me exactly where I touched you. If it's the right toe, the right finger, the left finger. So which digit is it? Which part of the digit, without opening your eyes. And a person can do it. They don't have to see it, but as soon as you touch them, that system in the parietal lobe says it's the left hand, the pinky, and it's at the end of the pinky. Yeah, sure. The patient or the person didn't see it, but they can relate to it. The message goes in, and then it's processed. The brain then creates a perceptive map, okay? So the person can then say, okay, it is left, right, it is, thumb or middle finger or pinky, etc., or it's the leg, it's my back. How far in the back? Well, it's about maybe 4 inches down my back. Their eyes are closed, but they can actually tell you with precision where they were touched. So, again, the body is a functioning system where the central nervous system is the monitoring agent. When we sleep at night, we don't think about breathing, but we don't die. Breathing continues. The heart continues to beat. Blood continues to flow. The brain shifts into low frequency, delta waves, and occasionally REM sleep. But the brain doesn't quit. The brain is still working, and when it's time to wake up, that's another issue with a clock in our brain. We can tell ourselves, you can go to bed tonight at 10 o'clock and say, I want to wake up at 4. And you can check it out.
Absolutely.
Around 4 o'clock,
Absolutely.
you wake up.
Absolutely.
It's like you gave your brain a message.
Instruction.
Instruction. And how does the brain write the instruction or take the instruction? I don't know. But I've tried it several times. Sure enough, around maybe 3:30 or close to 4 o'clock, I wake up. What time is it? Oh, yeah, it's about 4 o'clock.
Yes.
Because I told myself I want to wake up at 4 o'clock. So the human body is a magnificent organ. It's an organism.
Yes.
That we can't even stop to think all the processes that we go through being alive, what it means. We study it, and sure, we discover through research certain parts, how this part works, how that part works. But when you put it all together, it's a complex system. It's beautiful. It's amazing. And I think we can appreciate it. Too often, when nothing goes wrong, we think that, it doesn't matter what I do. But there are a lot of things that we do that hurts the system.
Oh, my.
And then when the system is, quotes unquote, broken or affected, then we realize how intertwined and how connected things are.
And that's a signal that comes out as a result. And there's a lot of focus on disabling the signal as opposed to correcting what caused the alarm signal to go off.
To go off, yeah.
Well, I think
The origin.
I want to wrap this up at this point, and hope that we can do some long-distance discussions with anything that we've kind of put on a table for other people to be curious about, this interconnection between the mind, the brain, and the body, and how acupuncture can leverage that relationship. So I want to thank you again so much for such short
Thank you for the
notice
invitation.
to be able to chat with me here
Sure.
and see if we can put a little more parameter around this whole concept of acupuncture and neuroplasticity. So thank you very much.